Today I'd like to share my experience in hybrid procedure in paravalvular leak. As you can see, there is white bar indicates the paravalvular leak. The incidence of paravalvular leak is 5 to 17% of surgically implanted prosthetic valve, and is related to tissue friability, annular calcification, or infection. And the patient shows heart failure symptom or hemolytic anemia. Traditionally, surgical repair is the treatment choice, but it shows significant morbidity and mortality. So nowadays, percutaneous closure is the best option. However, in case of severe calcification in the septal wall, it may be difficult to puncture the septal wall. So in that case, hybrid procedure was tried. So my patient is a 61-year-old male patient who had rheumatic heart disease and mitral valve replacement in 1979 with the tissue valve, and in 1988 redo MBR because there is some infection, and year 2000 redo MBR with the mechanical valve in our hospital because of the paravalvular leak. But as you can see, the patient shows as time passed, the pulmonary pressure increased, and the ventricular size is increased, and the ventricular function is decreased. And last case in 2012, LV and diastolic dimension was 25, and the pulmonary pressure was near systemic, and which pressure is very high. And he shows severe hemolytic anemia because of the mechanical hemolysis. Hemoglobin level was 7. And he also has liver cirrhosis. Also, chronic renal insufficiency. BN creatinine level is high. So in summary, this is a patient who is 61 years old and has a history of tridu mitral valve replacement, and also now shows the severe paravalvular leakage from the mitral valve, and the severe pulmonary hypertension, liver cirrhosis, and hemolytic anemia, chronic renal failure. So he needs another intervention, but surgeon refused the surgical repair. This is the chest PA. It shows the severe calcification around the atrial wall and in the atrial septum. And I think I would try to percutaneous closure, but the septal puncture may be difficult, so I choose a hybrid procedure. In the TE, there is a severe regurgitation from the paravalvular leak. And on the 3D image, this is the mitral valve, and there is a linear shadow, is paravalvular leak. And also on the medial side, there is another leak. Before I perform it, check the mechanical valve condition. It works well. Just like the valve motion is, as you can see, there is a calcification also. And the surgeon made left thoracotomy, and on the LV apex, the pulse string suture, and I insert the 9 French sheaths and insert the catheter and the wire, and I can go through the paravalvular leak with the wire. This is the wire, and then there is a paravalvular leak. And I first measure with the balloon. It's measured 7 millimeter, but it's a linear structure, so this does not exact size of the defect. So it's 7 millimeter, so I first insert the 10 millimeter vascular plug like this. And you can see the plug, and it does not damage to the valve motion. And I selected another one from the medial side and close it with a plug. However, even though I insert the one plug 10 millimeter, we can observe the severe leakage. And you can see that there is another linear hole, so that I closed only one side, so that I need one more plug. So I insert the wire, and first I insert the 60 millimeter plug, but it shows the severe leakage, so I removed it and insert the 12 millimeter plug. So finally, the patients had 3 plugs, and the paravalvular mitral leak has gone. Okay.